Well, I woke up this morning. I got myself a beer. Well, I woke up this morning and I got myself a beer. The future's uncertain and the end is always near. Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. Today, we're going to talk a little bit about how to address a multifaceted problem, like any complicated illness. How do you start to make some changes? And we started off with a nice little quote from Jim Morrison from Roadhouse Blues. The future's uncertain and the end is always near. We're going to talk a little bit about how to make changes now, realizing that the future's uncertain and the end is always near. And if you didn't hear last week's episode, go back and listen to that one first, because I talk about a patient with a whole bunch of problems, and I talk about how to address the immediate problems and not necessarily worry too much about the root cause at the moment, because you need to start somewhere. And it's important to start with the most dangerous part of the problem first. And that case last week is a patient with uncontrolled diabetes and high blood pressure, but this also applies to people with many other chronic conditions, people with inflammatory bowel disease, people with diverticular disease, people with fatty liver disease and cirrhosis, and many other health problems. So here's my feeling on treating a complicated disease and getting started somewhere. I think it's important that people are educated, and a lot of patients come in and say, I know I'm not supposed to look on Google, or I know that you doctors don't like people looking on Google, but I looked this up anyway, and now I'm worried about blah, blah, blah. That's not true. I actually like when people look on Google or wherever. I just wish that maybe the stuff on Google was a little more reasonable, or I wish that people knew what was good and what was bad on there, because there's plenty of amazingly great information on the internet. Actually, all of human information is on the internet, and if you know what you're looking for, you can usually find the answer. But you have to realize sometimes the limits of your own ability to do research on the internet if you're not a medical professional or a researcher, because the stuff that you see is not necessarily the whole story, and you don't know what you don't know, and you don't know what you're not seeing. So when you read about certain conditions, you can get pushed down a algorithm or a rabbit hole where you're totally in the wrong direction. And I've seen people come in all the time they've done, innumerable hours of internet research on some condition, and they are like totally off, like in left field, totally somewhere else about some other problem that doesn't even make sense in any situation. But they got there starting off logically, looking up some condition on the internet, and you make enough clicks and you end up in some internet wormhole where you're buying a supplement for a parasite that you don't have or something like that. So I really do want you to be educated and read about your condition on the internet. And every once in a while, someone will find something on the internet that's so spot on before I even thought of it. And I'm impressed. I'm not ashamed of my own knowledge or whatever. I actually am impressed that they found this thing and we tested for it and they have it. Like, that's the coolest thing in my mind. Whatever gets you better is what works. I don't need to be the one to discover it. If you discover it before you even come to see me because you did internet research, then it makes you look really smart, and that's cool. I'm down with that. But you also have to realize the limits of your own ability to interpret research. If you are not a researcher or don't have a background in science or a background in some field that looks at research regularly, and even if you do have a background like that, if you're not savvy at looking at this specific research in the little sub-genre of your field, then it's very easy to get misled. We saw this during the COVID pandemic, where scientists who have PhDs in medical type stuff were commenting on studies that were done by other scientists that have PhDs in COVID-related stuff, and they were totally off the mark. And it shows that even if you have a very closely related, very high level of training, you still cannot always interpret the body of literature, the body of research that is done in some other field. So if the scientists can't get it right in related fields that are not even that far apart, like I can't think of another scenario that's better than that. And if those scientists can't form a consensus and sometimes get things totally wrong, then what are the chances that the average layperson who is a school teacher or works in a restaurant or whatever is going to be able to interpret the vast body of medical literature that's out there on a condition that they're not even sure if they have or not? So that's the danger of the internet. It's not knowing what you don't know. And the plus side of it is that once you have a diagnosis or a condition, you can do lots of extra reading on it and become kind of like a expert layperson in your condition, which is pretty cool. You couldn't do that maybe, 30 years ago. But the important part is when you're approaching a disease that's complicated and has multiple, quote, root causes, or there's multiple factors that kind of lead to that illness, is getting started with some type of fix. So you have to do something. You have to change something in your lifestyle, start a medication, whatever it is. It's getting started somewhere, and then you learn as you go. Because if you waited to become an expert in diabetes, well, your cells are getting attacked by the high level of blood sugar every minute and every hour and every day that you're spending time researching diabetes or researching the root cause of your problem. You'd have to start somewhere. You have to do something to put the fire out, and then you learn as you go. So this is my business analogy, and this is how I kind of started this practice. I was in another group for a while, and I learned stuff about medicine, and I learned things about how to practice, but I never had to run my own practice. So when I decided that I needed to make a change and I wanted to leave, I didn't have the luxury of having the years it would take to learn how to run a medical business or a medical practice. Because a practice, at the end of the day, it really has to function as a business. Otherwise, you will go out of business and you won't have a practice. So if I didn't know how to bill insurance and collect copays and structure my day so that I could see enough patients and optimize the schedule and optimize buying equipment for the office and how much equipment do we use and what is the insurance that we have to carry and what kind of malpractice do I have to hold and what other licenses do I need and how often do I need to get the endoscopy suite credentialed and what does that cost and how much does that equipment cost and what is the cost to do a case in the endoscopy suite and how much does insurance pay for that case and how much do I have to pay staff to run the endoscopy suite and run the office and all that stuff. If I didn't know about that stuff, this practice would be out of business and I would not be able to provide medical care. So a medical practice, like every other thing that exists out there, still at its heart has to function as a business because people don't work for free and they don't give me electric for free and they're not supplying malpractice for free. But I didn't have time to take a course and to get an MBA in how to run my business. And I didn't have time to study someone's business for a year and optimize every little thing before I started this practice. So we started this practice in 2018. I was 5.5 years, 6 years, whatever it was, in my old practice. So I had a few months to do some research on my own about how to start a business before I had to give my notice to my other job that I was leaving. And then after that, I had about 6 months until I had to open the doors here. I was required to give my old employer 6 months notice, which is a ridiculously long time to give someone notice, but it's fine. It's what I agreed to. And during that time, I was able to do as much as I could to get the new practice set up on my off hours, which is not a lot of time. But the point is, you have to do some research. But once you realize it's something you're going to do, you just have to do it. You have to get started somewhere. And of course, you're going to make mistakes along the way. And there's a million things in this practice I would have done differently in the beginning if I knew what I know now. But I didn't know that. And there's no way I could have known that. And if I did know that, if I took the time to know that then, I'd still be reading about it. There's never a time where you know everything and everything's optimized and perfect and you're totally ready to start. There's never that time because the more you learn about it, the more there is to learn about it. And if I never just pulled the trigger and started this thing, it wouldn't be here. I would still be researching. It's much safer to talk to your friends and go read and learn about how to start a business than it is to actually do it. But when you throw some skin in the game and you get started, then you have to learn and you have to get it right because there's no other choice. The opposite of learning and doing at the same time is this thing that happens very frequently, which is paralysis by analysis. So the more you look at a situation, the more you analyze it, the more you realize you don't know. And the more you realize that there's more research to be done, or you need to learn more, you need to take this course, or you need to go talk to this person, or you have questions about this, you're going to research online and blah, 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 blah. And then you do nothing. And then one day turns into a week, and a week turns into a month. And all of a sudden it's 6 months later and you never did that thing that you wanted to do. And that might be starting a business. It might be starting a hobby. It might be starting an exercise routine or a new way of eating. And it might be starting to take care of yourself and starting to take your disease seriously and make a change. Because it's much safer mentally to go online and just start reading about other people's stories and figure out that Claudia from St. Louis found the cure to her diabetes by this one cool trick. And it was a supplement that she took, and it reduced her blood sugar by all these points because the problem was that she had too much cortisol levels and whatever else is being sold out there. But the issue is that person doesn't really exist. That story is probably fake. And what you should have been doing at that time was maybe going for a walk or getting some sleep or planning your meals out for tomorrow or making an appointment with your doctor or doing some reading about diabetes so you understand how to change your diet and exercise levels to optimize your blood sugar control rather than looking for some miracle pill or some cure that is probably a scam. Because if it really worked, wouldn't we all just do it? If that pill worked and reduced your blood sugar and had no side effects and was all natural, wouldn't you think we would just all do it? Everyone would just rate it so highly that you couldn't ignore it, and you would hear about it from friends and family that cured their problem. And B, don't you think the medical and pharmaceutical institutions would figure out a way to supercharge that herbal supplement or anti-parasite herb or whatnot and make a ton of money on it if it really worked? If it worked better than the drugs? Think of it that way. That's the devil's advocate argument. Wouldn't the evil pharmaceutical companies figure out a way to make money off that thing if it worked? So how come they haven't? How come they're pouring millions and billions of dollars into research to make more money than that, but haven't figured that one out yet, when Claudia from St. Louis has it all figured out? It's because it's probably too good to be true. So it's important to know what you're looking up, and it's important to do your research, but it's really important to get started with the stuff that is known to work. So how do you do it? Well, in our case from last week, our patient with uncontrolled diabetes and really high blood pressure, the right thing to do is find a trusted team and start working with them and put some trust in professionals and people who know what they're doing. Which doesn't mean just blindly find some random person who calls themselves a professional and trust whatever they say, because that's not a great idea either. You have to use your brain and you have to use a little bit of skepticism. But what you do is you find a doctor or two that works in the field and you get an opinion. And if the opinion of the first doctor sounds reasonable and you look it up and you find that that's kind of the standard of care, then maybe that's the standard of care for a reason, and you jump in and you start doing something that is prescribed. Medications, diet, lifestyle, and so forth. And if you don't like the first doctor's answer, or it sounds a little fishy, or you want to confirm, or you didn't get along with that person, then see a second opinion. See another doctor in that field and find out what that person has to say. And if they say the same thing, then maybe that's actually the answer. And if they say something totally radically different, then you have to use your brain and think about that one too. Are they really telling you the best choice, or are they telling you some alternative choice because you have already rejected the standard of care? So you find your trusted team and you find someone that you enjoy working with. The person that you get along with might be different than the person that your friend gets along with. Everyone's a little different. And sometimes you have to just click with your provider. And you find some other professionals in that space that may help you. Your doctor can't do it all. So you find potentially, if you have diabetes, you find a good dietitian, you find a good personal trainer. Maybe you need someone to help prep your meals. Maybe you need someone to come clean your house on the weekends because you need to make time for exercise and meal planning. Maybe you need to see a psychologist to help figure out how to make some of the mental changes or the psychological changes that are required to make a long, sustainable lifestyle change. Maybe that's the place to spend your time. Find a good doctor or two, find a good psychologist or a psychiatrist. But usually psychologists are a little more helpful with this kind of stuff. Start working with a dietitian, start working with a trainer, and then put in the work over time. Once you figure out the process and you've committed that this is the way, give it a time period. Ask your team, how long will it take to see a difference? Should I be looking at this thing in a 6-month timeline, a 12-month timeline? And then once you figure that out, say it's 6 months, you're going to work on this plan for 6 months of medicine, diet, lifestyle changes. You do it for 6 months, you put the time in, you make an earnest effort, and then you reevaluate things. You do your action, and then you adjust. This is the same way as you do in business. You do something, if it works, you stick with it, or you do it more, or you optimize it, make it a little better. If it doesn't work, you change the plan. You reevaluate and you change the plan as you go. You're never going to know everything, and you got to start somewhere. So once you figure out your timeline, you start breaking that down into much smaller timelines so you can kind of stay motivated and see some small incremental changes. So if you have a 6-month timeline to lose 15 pounds and control your blood sugar better and reduce your fatty liver, then you break that down into monthly timelines. What are your monthly goals? What are your weekly goals? What are your daily goals? And you can actually journal this all. You get buy a planner, or you do it on your phone, but the planner's the best because you can see it all. And you fill the boxes in. What am I doing this week? How many times am I exercising? How many meals am I eating? When am I going food shopping? Where am I going to be these days at work or with kids or wherever? And how am I going to fit in exercise? What days am I working out outside of my yard, or am I walking around the block? And what days am I going to the gym and working with my trainer, or going to the gym and doing my thing, or swimming, or whatever you're into? And you schedule it out. So you go from 6 months to monthly to weekly to daily. You schedule out your days. At 7 o'clock, I work out until 8 o'clock. And then at 8 o'clock to 8:30, I shower and get ready for work. And then I'm at my desk at 9, or whatever your day is like. What are you eating those days? Did you make your meals on the weekend? Did you pack yourself lunch? Or is someone else doing that for you? Or are you ordering food to the office that day? How are you doing it? How are you sticking to your diet? These are all things you can plan on a day-to-day and week-to-week basis. And then you look at your improvement over this 6-month period, and you circle back with your professionals and you say, is this where I have to be? What can I do to make this better if it's not working? Or if it is working, is it time to change up the plan, or do we stick it out for another 6 months and reevaluate at the end of a year? If you're making awesome progress, keep going. If progress is slowing down, as it often does, what can we add now? What am I ready for? If I'm working out with weights for 30 minutes twice a week, do I now have the stamina and the muscle to do 45 minutes twice a week, or to do 30 minutes 3 times a week, or whatever? How do I optimize things as I go? And if you look at yourself 6 months from today, the person who's doing the action is going to be in a much better place than the person who's still doing the research, or even worse, who's not even doing the research and just not even thinking about the problem and ignoring it. So once you embark on your changes, you also realize that there's really no end point. There's never really a time where you can stop doing the things that got you to the good place without sliding back to the bad place. That's just the way it is. So you conquer one small thing at a time, you climb a ladder one rung at a time, and then you move on to the next thing. When you get there, you're going to conquer that one too. But the important thing is starting today. Remember, tomorrow is an illusion. It doesn't exist. Tomorrow never comes, because once you get there, then you're back in today. So you can't count on tomorrow. You only have today. And you have to make today count. So you get started today in any little way possible. You go for that walk. You make that appointment. Maybe you're going to clean out the refrigerator today. Maybe you're going to go to the food store and fill it back up with some better, smarter choices. You're going to say no to those drinks today, or whatever it is you know you should be doing. The future you will thank yourself. It's just too bad you will never get to meet them. All right, that is the end of today's episode. I hope you enjoyed this little departure from the more factual, sciencey topics. And I hope you found that this episode was helpful or informative. If you want to leave me a question or a comment, please find me on social media under Real GI Doc, wherever social media is sold. Or you can leave me an audio message by clicking the link below. Until next time, go do something healthy today, and I'll see you next week.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.